Elizabeth. I'm a nursing student, and I would like to follow you today. Is that okay with you?
Sure. Yeah, I was just about to go to the med room to get some medications for our patient, and then I'll tell you about her when we're done, okay?
Okay.
Okay. So here we are in the med room, and in our Pyxis, we're going to pull up our patient, and today our patient is Shanana O'Connor, and it'll tell you right here what she's due for right now. So right now it's 7:36 in the morning, and she's due for a couple of things. She's going to get sodium chloride continuous infusion, as well as her antibiotic, which is due at 8 o'clock, so we're right in the time frame there. So first, we'll look at the sodium chloride. We'll get that one out. Okay, so we do the 5 rights for each drug each time. So we have Shanana O'Connor, and it is sodium chloride, and it is the right route. It will be IV. It's the right dose. So we have a 1,000 milliliter bag. As it says here, it'll be infused at 30 milliliters an hour. And it's the right time because it's continuous. And we want to check to make sure that it's not expired. This expires in 2022, so that's fine. It's clear, it's not cloudy, so it's good, and there's no leaks. Okay, so we have that one, and we'll need our primary tubing and our dilaflow for that one. And then next we have her antibiotic, which is Promoxin. It's imipenem with statin combo drug. So we take this out, and again, 5 rights. So we have Shanana O'Connor. It's going to be her Promoxin, and it's a 100 milliliter bag, 500 milligrams. It's going to be IV piggyback. That's the route. It's the right time. It's due at 8, and we're right in there. Again, this one is not expired. It's clear, and there's no punctures.
What is this button for?
And we're going to get our tubing for that too, and a flush, and some alcohol. Okay, so anytime that you have a question about antibiotic, especially this one, when I tell you about our patient, you'll know that she's on dialysis, so she has renal impairment. So we could click this little button right here, and it'll bring us up to the pharmacy, or we can call the pharmacy ourselves.
Oh, okay. Very good.
So we know that it's the right route, the right dose, it's appropriate for the patient. Okay? Okay. All right, so would you like to know a little bit about our patient?
Yeah.
So it's Shanana O'Connor, and she's a 34-year-old female. She is 80 kilograms, and she recently gained 10 pounds. She's a full code, and she has an allergy to sulfa drugs that gives her a rash. Her primary diagnosis was fever, chills, and malaise, but she is also in stage renal disease, so she's dialysis dependent. She's also a type 1 diabetic, so she's insulin dependent as well, and she has a history of UTIs. She was admitted because they think that she might have an infection. Her pain level was a 4, but she just received acetaminophen about 15 minutes ago, so she should be doing okay. She's alert and oriented ×4. Pearl is noted. She ambulates independently, but she does have some numbness and tingling in her lower extremities, so we might want to help her when she needs to go to the restroom. Her breath sounds are clear, and she has a productive cough. She has normal heart sounds with no murmur, but she is a little bit tachycardic right now. No chest pain or shortness of breath. She has 1+ edema in her lower extremities, and her penile pulses are just 1+, and they're weak and thready. Her radial pulses are fine, they're 2+, as expected, and her cap refill is less than 3 seconds. She has more normal bowel sounds in all 4 quadrants, and her last bowel movement was yesterday, but she has a decreased appetite lately. She's on a 1,500 milliliter fluid restriction, and she voids herself, but lately it's been difficult, so we had to straight cath her this morning. And her urine was amber and cloudy, and urinalysis did come back, and she has white blood cells on her urine. So she has dialysis 3 times a week, and she just got back from dialysis. Her last set of vitals was at 7:30, and her temperature was 101.1, so it's elevated. Her heart rate is 95, so she's tachycardic, and she has a 96% O2 stat, as well as a 138/78 blood pressure. She has an IV in her right forearm, which is where she's going to get the medications we give her today. And her medication is the antibiotic, the Promoxin, and the normal saline. Do you have any questions for me?
Yes, I have a few questions for you. Why is the client receiving this medication?
Well, they think that she has a UTI, so she's going to get the antibiotic to help get rid of that.
Okay. What action does the medication have on the body?
It's a broad spectrum antibiotic, so this is bactericidal and it binds to the cell wall to kill the bacterial cells.
When should you question giving this medicine?
If the patient has hypersensitivity to the drug, and also if they have any allergies to penicillin or cephalosporins, because it could be a cross sensitivity.
Okay. Does the medication have therapeutic serum levels?
No, not this one.
Which vital signs should be monitored?
Well, all of them, but especially fever, because that would mean that her infection is still present.
Okay. Which physiological parameters should be monitored when the medication is given?
Any signs of infection, and especially anaphylaxis reaction.
Okay. What intervention must be taught to the patient to ensure the medication is given safely in the hospital setting?
If she has any adverse reactions, so especially if she has diarrhea, you want to call us right away. And yeah, diarrhea.
Okay.
Nausea, vomiting.
What intervention must be taught for taking the medication safely at home?
Well, we want to tell her that she needs to finish the entire medication even if she starts feeling better. And if she does develop diarrhea, even if it's weeks later, to call her physician and not try to treat it by herself, because that could be an adverse reaction.
What are the side effects and potential adverse reactions?
Well, it could make her nauseous or cause her to vomit, and it could make it difficult for her to breathe. And diarrhea is a big one too. We want to look out for C. diff.
Okay. How would you know if the medication is effective?
As long as her signs and symptoms of infection are decreasing, that's a good sign, but it could take days or weeks depending on the organism that's affecting her.
Oh, okay. So for now, I don't have any more questions.
Okay. And when we do look for those signs and symptoms, we're going to document those in the EHR each time so we can see a trend to see if she's getting better or worse. Okay, so do you want to go meet the patient?
Oh, yeah. Okay.
Hi, my name's Jasmine. I'll be your nurse today, and I also have Elizabeth here. She's a level 1
Hello.
nursing student. Is it okay if she follows us today?
That's fine.
Okay. So, could you tell me your name and age?
I'm Shanana O'Connor. I'm 34 years old.
Do you have any allergies?
I have an allergy to sulfa drugs.
Sulfa drugs? Okay. So I checked her wristband, and I just want to make sure that it matches the computer here. So it's Shanana O'Connor, 34, and it says there that she does have an allergy to sulfa. Try this. Okay. So the doctor has ordered you to be on normal saline, and we're going to hang an antibiotic to help with your UTI today, okay?
Okay.
All right. Have you ever taken Promoxin?
No, I've never taken it before.
Okay. Well, I'm going to hang that after the normal saline, but I want you to look out for a couple of side effects.
Okay.
If you feel nauseous, or if you feel like you're going to vomit, or if you have a rash or start itching, please call us immediately.
Okay.
And I saw that you have some numbness and tingling in your legs, so if you need to go to the bathroom, you can call us and we'll help you.
Okay.
Okay? So first, we're going to flush your IV to make sure that it's open before we hook anything up. So, you want to clean the port anytime you're going to do anything with a patient's IV. And it's flushing nicely. Very good. Unclamped, of course. Alright, so first we're going to get her ID to double check the medication. This will be our second check. Alright, so sodium chloride first. So we click this green button here. And we put in our patient ID number. Could you tell me your name and age, please?
I'm Shanana O'Connor. I'm 34 years old.
Okay, do you have any allergies?
I have an allergy to sulfa drugs.
Okay. And when we get this in here, that's going to confirm. green light, so that means that we have the right patient and the right medication. We have Shanann O'Connor, she's 34 and she's allergic to sulfa. Okay, so again, we do our 5 checks. We know we have the right patient, we have the right drug here. It tells us it's sodium chloride. It's going to be the right route, which is IV, the right amount, so 1,000 milliliter bag, and it's going to go at 30 milliliters an hour because she's on fluid restriction, so we don't want it too fast. And it's also the right time because it's going to be continuous. Okay, so we're going to go ahead and get that set up. So we have our primary tubing here. We'll make sure that everything is clamped so we don't waste any. And our spike needs to stay sterile. So before we hook it to the patient, we're going to prime to make sure there's no air bubbles in the line. So we unclamp. Unclamp, and we're priming, getting all the air bubbles out. Okay. Clamp it back, and before we hook it to her IV, we're going to clean again. And we have this hooked to our Dialoflow. So this will be, and it says here, at 30 milliliters an hour. And we'll unclamp that and make sure that it's running. Alright, and we'll document that we did that in her right forearm. At 7. Okay, and next we'll do our Pramoxine. Could you tell me your name and age, please?
Shanann O'Connor, 34 years old.
Okay, do you have any allergies?
I'm allergic to sulfa drugs.
Okay, and this, her sulfa-allergy, this won't be affected. This will not affect her. Okay, and we have the green light, so that means that we have the right patient and the right medication. So we'll do our 5 checks one more time. So we have Shanann O'Connor. The right drug is Pramoxine. It's going to be IV piggyback for the right route, the right dose. It's 500 milligrams and 100 milliliters. And it's the right time. It's due at 8 o'clock. It's now 7:50. Okay, so we'll get that set up. So again, with your spike, we'll keep that sterile. Make sure this is clamped so we don't lose any.
See you later.
Okay, and when you hang an antibiotic, whatever you want to run first should be hanging higher. So we'll put our normal saline down low until the antibiotic is done. Okay. And I'm going to do a backflow. So we'll clean the port that we're going to hook it to. our dial flow because this is going to go at 100 milliliters over 1 hour. So I'll adjust our dial flow and we'll have to come back in 1 hour and turn it back for the normal saline. Alright, everything's open. Let's label our tubing so any other people that come in, they'll know exactly what's going on. I do the antibiotic, the rate, the time, the dose, and my initials. Okay. Shanana, how are you feeling?
Doing pretty good.
Okay, can you tell me some of those side effects that we talked about earlier?
If I feel any nausea or vomiting, or especially diarrhea, and if I need to go to the bathroom, I should probably call you guys.
Okay, thank you. And you have your call light right here?
I do.
Okay. Be back in about an hour to check on you, okay?
Okay, I'll be expecting you.
Alright, I'm gonna wash my hands, and I'm gonna document here. Okay, so I gave that at 7:50. Alright, did you have any other questions for me?
I don't. Not right now.
Elizabeth, did you have any other questions for me?
On the sunset, yes,
Save this.
Oh, no problem.
Hands one last time.
The patient wants to talk.
Alright, Shanana, we'll see you later.
Okay.
I have few more questions for you. What any pertinent information you review before giving the medication?
Yes, I did. Well, she said that she's allergic to sulfa, so I made sure that the drug was compatible with her. I also looked at her white blood cell count, and she has a UTI, so she needed the antibiotic.
Okay. Did this information affect your decision to give the medication?
Yes, it told me that she needed it.
Okay. Did this information affect how you administer the med?
Well, it told me that I needed to administer it IV, and I agreed, so it was all good.
Okay, so that's good. So I don't have any more questions for
Okay.
you. Thank you for your time.
Thank you.